Welcome to Keiko Vision, a podcast to pump you up to change the world. Hosted by me, Jordana. Let's get started. So last week I talked about the looming retirement crisis and the impact of the aging baby boomer population. This week, I'm going to talk about another problem that we're already facing when it comes to senior living and senior care. I'm going to share a conversation I had with my boyfriend, Peter, who happens to be a traveling nurse, and get his perspective on this problem. Why don't you give me a background of what brought you into nursing and what your experience has been so far? And a little bit of your just general background.
Okay, I have a degree from Penn State in business administration. Then I have a degree in health policy administration from Penn State. After that, after I graduated from Penn State, I was working in nursing homes as an environmental director of housekeeping, laundry, sometimes maintenance. After I left that field and went to prison, I decided I wanted to become a nurse. I didn't want to be an administrator of a facility and not know what people were talking about medically. So that was not a requirement when I got the business or the health policy administration. So I thought I would be a better administrator and better person to lead nurses and people in healthcare if I actually knew what they were talking about. Well, I went to nursing school. It was a temple-based program down in Pittsburgh in Philadelphia. And once I hit the floor, I actually liked it and never left. And that's been 18 years now.
Awesome. So what have you seen over those 18 years? Have there been any shifts? Have there been from when I look at the statistics and, how many people are aging, it seems like it's stressing our system, but you have close to 2 decades. So
My personal opinion, the shift started about 10 years ago. When I started nursing, it was more focused on what we could do for the people and try to help them and try to ease their life and make sure that they were okay. And we were given the means to go ahead and make their lives better. About 10 years ago, in my opinion, when the Medicare reimbursement got adjusted to what they're doing now, and they rate people, and that's how they do the reimbursement. That was about 10 years ago they started doing that. I think that's when it started becoming more money-based. People were more worried about money because they want to get as much money as they possibly can for each individual resident. So they want that resident not to be able to do as much for their own. So they're taxing the system, trying to get as much, every last dime out of them, instead of worrying about what's best for the person.
Yeah, and that makes sense. The vast majority of nursing home facilities and long-term care facilities are for profit, and between 70 and 80%, and there's not very stringent regulations. So when you combine those two, a for-profit institution with not too many regulations,
actually, the regulations on the nursing end in a nursing home, there's more regulations on how you have to take care of somebody than there are for a nuclear power plant. Long-term care has actually the most regulations of any business in the country.
Well, long-term care versus nursing care.
Yeah.
Yeah, nursing homes have a different quality and regulations as opposed to other long-term care facilities. So then so many of these long-term care facilities are opening up for what would have been considered nursing homes previously, like dementia patients, but they're assisted living facilities now,
Yes. Well, part of the problem is the level of skill that is expected in a nursing home has been increasing. What used to be a person would stay in a hospital for, they're coming to a SNF unit, a skilled unit, and a step-down unit, and they're expected to take care of them. But the regulations aren't giving you the money for that reimbursement. They're not giving you the staff for that, and the companies are not paying the staff for that because of the fact that oh, I could have one nurse for 30 people. It doesn't matter what the care is. And the government doesn't say, if you have this care level, you should have this many nurses.
Yeah.
They go ahead and you say you only have this many nurses no matter what the care level is. And that's wrong.
Well, and
it should be broken down to what you're doing and who you're taking care of. And these people, the actual businesses, are making money because sure, there are a lot of regulations, but there's ways around that regulation. Like the PPD in Pennsylvania, right now you're sitting at 2.4.
What is PPD?
Every resident, every resident is supposed to get 2.5 hours of care each day. All right. So you have to staff for every resident to get that care.
Mm-hmm.
You know, someone might not need it, and some get more, but that's what they're based on. That's the minimum staffing they have to have. But what they don't do, like what the government's not doing, is mandating that it's actual personal care that people are getting counted as that. So if you have an RNAC who does nothing but deal with numbers, they're counted towards personal care. If you have supervisors, they're counted as they're on the floor. You have a director of nursing, she's a nurse, so they count her on the floor when she doesn't even know what's going on.
Yeah.
So all these people are getting counted towards that number to take care of these people, but they couldn't even tell you who's John or Susie.
Mm-hmm.
They're not on the floor. So the government's not making sure that people that actually need the care and people that are actually doing the care are counted right. You got states like California. You got states like California who up their PPD, which is good, and Pennsylvania's supposed to be soon. They go ahead and up their PPD, but what's going on is they're not even hiring to staff it that way. The companies are taking the fines. It's cheaper to take the fine than it is to pay staff.
Yeah, well, that's a huge issue. When it's easier to just pay the fine than to handle your business properly.
I can give you an example that I went through.
Go for it.
I had a building that caught on fire. Now this is back in the early 2000s. The building one floor caught on fire. So they went through the unit and was evacuating the unit. The director of nursing and the administrator didn't know how to break down a bariatric bed. It's literally you pull 2 pins in the mattress straps on the ground, you pull the mattress out of the room. Well, they couldn't figure this out. So there's 3 residents that were bariatric in this room. They literally put a towel in front of the door, told the residents, we'll be back for you, and shut the door and left them in there as the fire was going. Okay? Well, after the fire was taken care of, the one resident that was there was on borderline being a bariatric. She wanted to go upstairs. Well, when she got moved to the 2nd floor, which legally she shouldn't have been moved to the 2nd floor because she was past the weight limit of what you're supposed to be without having a direct way out to the building, but they put her up there anyway. I went to administration. I said, you can't do that because it's against the law. You're putting a 375-pound person in a 350-pound bed. I said, that's breaking a law. She's on the 2nd floor. That's breaking a regulation because of the fact she's supposed to be on the 1st floor and you have bariatric. And in Pennsylvania, bariatric patients start at 350 pounds. She's 375 pounds. You cannot do this. They told me, don't worry about it. All right. 2 weeks later, they went to roll the lady. The lady's bed tipped over. And the only reason why she wasn't killed, she did get her leg broken, was she had a recliner in the room and the bed caught on the arm of the recliner and didn't smush her.
Yeah.
They got a $200,000 fine. Then they moved the lady back downstairs where she was supposed to be. But that lady would have got killed, and I was literally told to mind my own business. I don't know what I'm talking about.
Yeah.
When I went downstairs to talk to the administrator looked at me and said, I know you're going to tell me I told you so. I said, I don't have to. You already know I knew it.
Yeah, exactly.
That lady literally almost died because they didn't want to listen. There were regulations for the building to follow, and they didn't want to follow it. So they figured they'll just pay the fine if they get caught.
Yeah. Yeah, no, that's what it seems like a lot of companies are doing. And I think part of it is that there might be regulations, but the oversight on those regulations are non-existent for the most part.
For the most part, yes. You know, Do you know how the inspections and all work or no?
I don't know how the inspection works. I know that they
Okay.
have capped the number at 88 facilities that are on a federal watch list, even though they fully acknowledge
Yes.
that hundreds more would qualify based on the criteria, but they just don't have the staffing
What
to do it.
Yes. What happens is if you're in a facility, a skilled facility, you're actually given a window. So you know within 2 months of when the state's coming in. So people there were staff when they're coming in, they clean up when they're coming in, they know all this ahead of time. So it's not like a surprise inspection anyway.
Okay.
You don't know exactly what day they're coming, but you do know they're coming.
Okay, so for when I wait. So when I worked at Domino's when I was 18 or 19 and they had their surprise visits, they were actually providing more oversight than our government is providing when we're working with our seniors that are incapacitated. Okay. Just wanted to make sure I was understanding that correctly. Because we want to make sure we have the correct amount of pepperonis on the pizza, you know.
Yes, exactly. So the funny thing is, like, if you work on the floor like I do, these people that don't know anything about, you tell these people to leave because they're trying to quote unquote help you. And they'll come up when lunch is being passed. They'll come up when dinner's being passed. They don't know these residents. They'll kill a resident. They'll try to feed them something they shouldn't be feeding them because they want to show they're helping.
Yeah.
And that they're on the floor all the time when they never are.
Yeah. So it can actually cause it can end up causing damage when you're when if you were left alone, it probably wouldn't have. But yeah, it's just because you're not in the practice of following the regulations from the beginning.
Are you in your thing? Are you dividing between long-term care and assisted living?
So
what's going on now? Assisted living has a lot more has a lot laxed
leeway.
rules.
Oh yeah.
It's skilled nursing. Assisted living is going ahead and bringing in more skilled people, and they don't have the skilled workers to take care of them.
Yeah, and that was so I put together kind of videos of stuff that's already out there and available, but just kind of mash it up to kind of prove a point, and it does go in between the nursing care and the assisted living, and all of the, like, especially when it comes to dementia patients, there's been a huge, and I see it even in the central Jersey area. There are all of these assisted living facilities that are geared towards dementia and memory loss, and then
they have memory units.
As somebody who has family that you know, struggled with Alzheimer's, I know that an assisted that requires more than assisting daily activities. That requires extensive care. And that's not being
doesn't require extensive care. If you got a place that does it right, there's actually training out there for the units, and places that aren't chasing that almighty dollar, they'll make sure everybody working on that unit is trained right. And before you make it on that unit, then you know what you're dealing with. But a lot of it's not required.
Yeah.
So since it's not required, places that are trying to cut dimes don't do it.
Yeah.
People only do
what they're required to, especially when a system is already stressed, right? It's you wouldn't naturally take on more and I guess I should qualify that, because you have taken on more responsibility than you really needed to help out others. But for the most part, most people aren't going to take up more responsibility than they actually need. Yeah. But we've got a situation now.
Just because of who I am.
It's who you are and the relationships that you've built, right? Like, so you had told me earlier today that somebody that we had talked about before, that you had stayed late to help her out on her shift. And she just quit. Well, I don't even think there was any notice, right? It was just
No,
I'm
she
done with
walked
it.
out. Then
Right? Like,
she just literally walked out.
yeah.
And it was because they kept screwing with her, and finally she just had enough.
And we've talked before when you've started your shifts. So you work 6 days on and 8 days off. And so
Yes.
during that 8 day period, it seems like questions start to accumulate and that you come on and then there are a bunch of people coming up and asking you questions. And so for me, logically, I'm like, well, what happens if you're not there, right? Like
Exactly.
like
Why are they even today? I had 3 different residents and 2 different staff members ask me if I could do an extra day this week. And I said, no, I'm done tomorrow. And they're like, but what are we supposed to do when you're not here? I said, they're supposed to have people here qualified. I had a gentleman come to me today talking about his dad. Now he goes, when you're here, my dad gets his pain medicine. My dad gets, they bring in food for this guy because they don't like the food they're being served. And that is an issue at the place I work. But they're bringing in food. He goes, when you're here, I don't even have to worry about it. I don't even have to question anything, my sister, anybody. But he goes, the problem is when you're not, we don't know what we're getting. It's like pot luck.
yeah. And there's been people, so the video that I'll release with this podcast shows there's like videos of people going on like live TV and saying that they cannot do their job the way that they're trained to do their job because there are way too many people and it is impossible. And
Yes.
and
you do everything by the book and the way it's supposed to be done. It is impossible to do it.
yeah, and so for me, I'm looking at the situation that we're in now. And last week I had talked about the retirement crisis, and we have the baby boomers. The average age of baby boomers 64 years old. The average age of a retiree is 64 years old. When it comes to 65 and older, there's been studies that population in the next 40 years is going to double, and that 2/3 of them will need help at some point with daily living needs. And so I'm looking at a system that it seems like right now it is already stressed. It's stressed to the point where they are paying penalties, they are paying out lawsuits for dementia patients that are wandering out and getting eaten by crocodiles and catching on fire on Christmas Day and falling out of windows. And like it's already a really bad situation now, and it's only going to get worse, and not just get worse kind of on the same level that it's been getting worse. It's going to magnify pretty drastically over the next few years.
Pennsylvania about 4 years ago lowered the requirements what you needed to be an administrator. Okay. Mm-hmm. Before you had to do certain things and you had to be involved in the building, this and that. Now, and you had to have a minimum of 4-year degree. About 4 years ago, they weren't getting enough people trying to do the job. So they go ahead and lower the requirements and say you don't have to have a bachelor's. All you have to do is be someone that ran a department in a nursing home for a couple of years.
Mm.
So someone that's running dietary or maintenance or laundry can be administrator in the eyes of the state of Pennsylvania just because they know the business. But they weren't, doesn't mean they know how to take care of people. It doesn't mean they know the business end. It doesn't mean that they're looking out for the people best. They just know how to cook. But now they can be an administrator.
Yeah, and we've talked just personally because you've thought of that path as a potential future for yourself.
Yes.
And for me, when I look at it, it seems like that is more headaches than anything else, right?
Yes, honestly, it is.
Especially because I don't think the administrators are making a significant amount more, if any more, than
I make, honestly, if I know for a fact that I make just as much as an administrator running a 240 bed building.
Yeah. And so that's like, do you want to take on that extra stress and extra responsibility? You know?
Yeah, I actually know an administrator in DON, Director of Nursing in Massachusetts. Like, I physically know them that are serving 5 years apiece for an incident that happened in a building that they weren't even in when it happened.
Are you kidding me?
No, I'm not kidding you. They were responsible for it to happen, but they are in jail right now.
Okay, so I've not heard this story before, but let me guess that they were not in like one of those really high tax brackets. That they were,
no, they were not.
Yeah. And this is the thing that like it drives me crazy because there's an instance and there's multiple instances, but there's an instance that's included in the video clips of a woman who owned 6 assisted living facilities in California and was banned from the state because her practices were so terrible. She wasn't paying her employees. There were multiple instances with the people in her care. And so she ended up filing bankruptcy, keeping a mansion. Her dad now owns the property company for all those 6 assisted living facilities. And up until like 2 years ago, she was still listed as the CEO on the companies,
Right.
even though she was banned in the state. It's like, if you have enough money, you can use the bankruptcy laws to get yourself out of whatever you need to.
There's a guy in Bryn Mawr that did the same thing. He ended up doing federal time when it caught up to him because he was taking loans out on his building, okay? And he was getting federal loans subsidized to help him because they were nursing homes that he was so-called renovating.
Uh-huh.
He would renovate the lobby, take out $5 million loan. He did it 3 different times. Renovate the lobby so it looked nice when the banks came in and saw it. Not touch anything else in the building and kept the rest of the money. He did this 3 times before they actually caught him, and he ended up going bankrupt. But he was not paying his employees. I personally know a doctor that was his medical director that he owed over $1 million for.
Oh.
And his bankruptcy settlement, my friend got literally 10 cents on a dollar. He got $100,000 out of $1.1 million that he was owed.
Yep. Yeah, that's. I'm trying to like find the notes on. I don't think I had the amount that was actually paid, but the employees got screwed. The patients got terrible care, and this woman.
Yeah. Well, this place literally, the medical director convinced me to go in there because he needed help, and I'm friends with him. And I said, fine. So my first paycheck was for $2,200 working there, right?
Uh-huh.
And someone looked at me and said, make sure your check doesn't bounce. And I laughed. They're like, no, seriously. All last paycheck, everybody's check bounced. So I took my shares, went into the owner's office and said, you're paying me cash. He goes, huh? I said, I'm not leaving. You're not leaving until I have $2,200 in front of me. I got kids to feed. I didn't do this for charity. I ain't a slave. I'll get my money.
Yeah.
And you count out my $2,200 in front of me.
Yeah. I don't think most people get that response though. And I think that maybe, the people that they really, really, really need to keep on staff might, but most people wouldn't even ask for it.
Yeah. But I was the only one in that whole group. There had to be 30 people there. I was the only one that went upstairs. I said, I'm going to get my money. They're like, they all laughed. They're like, you're joking. We'll get it. We'll eventually.
I do have to, I've got to send you the video though, because this girl was like, you listen to her and you want to hate her, because she sounds like, I don't know, like a valley girl, like she just and she's driving I don't know if it was like a Ferrari or a Porsche, whatever. And she just like she sounds like you want to hate her, but you're like, I feel bad. Like, I don't want to hate somebody just because they sound like a douchebag, you know? And then you find out that she's like had multiple violations for staff and patients and like banned for life. Like banned for life. And she still gets to keep a mansion. It's like, how is that? Like, if you don't have millions of dollars, if her dad wasn't able to take over all of 6 assisted living facilities in his own property management company, she probably would be going to jail. But because she has that money behind her, like, different rules apply. And when different rules apply, when it comes to assisted living facilities and the amount of money that they can generate, and especially because their sweet spot age patient, you know, like that, they're going to be getting a lot more demand in the coming years. It's just, it's asking for bad outcomes.
Yes, I agree, 100%.
To back up a little bit, so the two of us were talking for a few months before I realized that you were actually in the same facility that my grandfather was just discharged from, right? So well, not discharged. I don't know if that's the right word. He went to a hospital. He had a brain bleed and went to rehab in the facility that you work in. And you guys didn't work together. Thankfully, I did not hear the best from, from the people that were around him, not from him directly, but from the people that were around him during that time. They said that the rehab did not help his situation. And if they knew that going in, they wouldn't have done it. It was, they were waking him up at weird hours to give him medication. It was like he couldn't get into a daily routine while he was there. But that aside, just finding out that you worked in the same place that he was going to, seemed a little bit like the universe doing its magic, just because the two of us had been talking for a few months beforehand. And I don't know. It's like I see my grandfather and the care that he can get now, which still, it's spotty. It depends on who you get, but he's getting round the clock care in a personal home, which most people would not be able to afford, especially going forward. Like this generation, my grandfather's generation, yes. My mom's generation, less so. My generation, we're going to be a burden on our kids because most likely a lot of our parents are going to be a burden on us. Not my parents, but a lot of our parents will be a burden,
I agree with that 100%. Because you're what I call a sandwich generation, because you're going to have to be taking care of your parents and still taking care of your kids.
Yep. And this generation just got screwed with so many things when it comes to education. Like education skyrocketed, healthcare skyrocketed, and a lot of the things that it affects all generations, but it's affecting I would say the millennials probably the hardest. And it's a generation that's been barely able to get their own house, whether or not, a lot of them haven't been able to get their own homes. And pretty soon they're going to be ending up having to, get multi-generational housing, which I don't necessarily think is a bad thing. A lot of countries have that as a commonplace. And I think that that's the only direction that we end up going in the US because we don't have many other options.
Yes, I agree with that.
So have you heard of the term resident dumping? Do you know
Yes.
do you know what that means?
Yes.
So like the people that can't afford for their rooms, the people that are on Medicaid at the time instead of Medicare, ending up like getting dumped at homeless shelters.
Technically, the way the laws are written in Pennsylvania is you have to have a safe discharge. You have to be able to be taken somewhere that is a safe discharge, okay?
Mm-hmm.
And what I have personally seen, is them taking them to a motel or not like a real motel, but a rent a room. And they'll rent a room for the person and pay their rent for a month. So legally, they're discharging them to a safe place. But after that month, what's that person supposed to do?
Yeah. Well, there was, I think it was in California where it was just a straight, like a van from the facility to a homeless shelter. And that was it. Like for me, I think it's terrible where we're at right now.
Yes.
But then when I'm looking forward next 5-10 years, it terrifies me. It's not just like, this is bad. This is something that it's like, it's going to affect the whole country and people don't realize how big of an issue it is.
No, they don't.
So you're going to take care of me when I go senile, right? The dementia that's in my family, the Alzheimer's that's in my family, and my memory issues. You'll take care of me, yeah?
You have absolutely nothing to worry about.
Good.
Nothing.
Well, thank you so much, Peter, for joining me on the show today. I'll post some resources along with this episode on the website, keiko.community. Thanks for listening, and see you next Tuesday.
Keiko, the social app. K-A-K-O. Keiko, the social app. K-A-K-O. Keiko, the social app. Keiko rules. Keiko, the social app. Billionaire greed. Keiko, the social app. Destroying America. Keiko, the social app. T-minus 7 years and counting. Keiko, the social app.